Imagine this, you've just injected your insulin. Then a few minutes later, you're sitting on the sofa, lounging, and boom, suddenly a thought pops into your head. Wait a minute, did I already take my insulin? Hmm, your heart starts to race. You check your insulin pen, you're not sure, did I or didn't I? And then you're trying desperately hard to remember, but you can't. Or perhaps you accidentally took your rapid acting insulin instead of your long acting insulin. Looking at another scenario, maybe you've taken your diabetes tablets twice because you forgot you had already taken them. If you have ever been in this situation, you are definitely not alone. As someone who has lived with type 1 diabetes for nearly 40 years, I know how frightening these moments can feel. Living with diabetes means making hundreds of decisions every single day, and sometimes mistakes are bound to happen. So, today I'm going to explain what happens when you take too much insulin, what happens when diabetes tablets are overdosed, the warning signs to watch out for, and what you should do immediately when you should seek emergency medical help. Most importantly, I want to help you know how to stay calm and be prepared should this ever happen. Let's begin with the question, why do medication mistakes happen? Many people assume medication mistakes happen because someone was careless. I beg to differ. That's usually not true, nor the case. In reality, diabetes self management is mentally exhausting, and you may just be looking after children, working long hours, managing stress, living with diabetes distress, experiencing so much burnout with your daily self care, or you might be feeling unwell or even sleep deprived. These things happen more often than you might think. Moving forward, what happens when you take too much of insulin? We all know that the job of insulin is to lower your blood glucose levels. When too much insulin enters the body, glucose can fall lower than the body needs. And this can result in what we know as hypoglycemia. The severity will really depend on the dose that you have taken, the type of insulin, your individual insulin sensitivity, whether you have eaten before you took the insulin, and physical activity. Let's look at a real life scenario. Imagine you normally take 8 units of rapid acting insulin before your dinner, and one fateful evening, you suddenly got distracted by a phone call. After the call, you can't remember whether you took your insulin or not. In order not to be without any insulin at all, you now decide, I'll take another 8 units just in case I didn't take my insulin before my meal. Then later on, you now realized that you already had taken the first dose. You've now taken 16 units instead of 8 units. So, what should you do? The first step is to understand what happened and take action early. What you should do immediately: relax, take a moment, work out what happened, what medication was taken, how much, and when. The more information you have, the better decisions you can make. That's you being a diabetes detective. So, step 2, you move on, check your glucose levels. You could use either a CGM or a blood glucose monitor. A common mistake is assuming that you are safe because your glucose is currently normal. But you need to remember and have at the back of your mind that insulin may not have started working fully yet. So you need to continue monitoring very closely your blood sugar levels. So now, step 3, prepare all your carbs just in case your blood sugars drop dangerously low. So depending on the situation, you might need your glucose tablets at hand. You might need some fruit juice. You might need bread, a few biscuits, or your regular sugary drinks. Step 4, very important, you need to tell someone. This is extremely important. I cannot overemphasize. So you let a family member, a neighbor, a colleague. You do not want on any circumstance to manage a potentially severe hypoglycemic episode completely on your own. Next, we would look at what will happen if you take too many diabetes oral medications. In this situation, you must bear in mind that not all diabetes medications carry the same risk. Some medications rarely cause significant hypoglycemic episodes when taken alone. However, medicines such as glycoside can cause prolonged low blood glucose levels. And this can sometimes occur many hours after you have taken the overdose. That's why you should never assume that you are safe simply because you feel okay initially. When should you seek urgent help? This is what we're going to look at now. When your glucose levels remain low despite you treating the hypoglycemia, or you become really confused, or you cannot safely eat or drink, or you lose consciousness. You're quite unsure how much was taken. A large dose of insulin or oral medication was involved. Never you ever feel embarrassed about asking for help. My final message today: medication mistakes are bound to happen. What matters most is you recognizing the situation early and you respond appropriately. The goal is never about perfection. The goal is for you to stay safe. If you've ever accidentally taken too much insulin or oral diabetes medication, I would love to hear your experience in the comment section. What happened? How did you handle it? Your story could actually help someone else navigate a similar situation. If you found this video very helpful, please, I would like you to like, subscribe, and share with someone living with diabetes. Lest I forget, this video provides educational information and it's not a substitute for personalized medical advice. And this is me, as always, blowing reality-based diabetes education your way, and I'll see you all in my next video. Don't forget to hit that subscribe button, okay, so that you'll get notified when new videos are uploaded. Bye.